Some Canadians sound like they still need a bit more convincing about the AstraZeneca vaccine. That shot, key to this country's plans to protect as many people as possible from the coronavirus. We're already seeing AstraZeneca being given out and administered in expanded vaccination campaigns. But this morning, more countries raising new concerns about its safety. Public health officials in this country, though, restating their confidence in the vaccine. So we'll bring in John Northcott to lead off our coverage this morning with John, what some countries are doing and the very strong response and the word of reassurance from Canadian bodies this morning.
Yeah, that's the story, Heather. Concerns from a number of countries, Denmark, Norway, Iceland, now Bulgaria and Thailand, at least temporarily suspending, if you will, the distributions, particularly of the AstraZeneca vaccine. But this is something that, as this vaccination process rolls out around the world, this probably won't be the last time. There are concerns raised here and there are reassurances being issued on this one from a number of authorities, including the WHO saying no causal relationship this morning, no deaths associated with the use of the AstraZeneca vaccine. Health Canada coming out late last night and putting out a statement explaining the whole rationale behind it. Let's look at that in terms of what Canadian officials are saying. Health Canada aware of reports of adverse events in Europe following immunization with the AstraZeneca COVID-19 vaccine, and would like to reassure Canadians that the benefits of the vaccine continue to outweigh its risk. The statement goes on to say, Health Canada authorized the vaccine based on a thorough independent review of the evidence and determined that it meets Canada's stringent safety, efficacy, and quality requirements. And finally, at this time, there's no indication that this vaccine caused these events. Now, these events that they're talking about here are effectively a thrombosis, a blood clot in 30 cases. Now, this is out of 5 million vaccines administered in Europe and 11 million vaccines administered in the UK. The argument being, from health officials, that when you give those many vaccines to that many people, especially people potentially in a risk group with comorbidities, there are going to be effects, not from the vaccine so much, but health problems that result just because of the age and the condition these people are in. We're hearing similar sentiments from at least one public health officer here in this country. Here's Dr. Dina Hinshaw.
I want to assure everyone that the current doses of Covishield AstraZeneca vaccine offered in Alberta have not been linked to these issues. But the bottom line is that there is no current evidence that the vaccine is causing the reported blood clots, and we are not using the same batches of vaccine as were used in Europe.
In fact, we're finding a number of medical experts surprised that, in fact, the countries that we're talking about here today have taken action because they argue there is so little evidence. Let's listen to one of our experts just speaking last hour here on CBC News Network.
Important thing is it happening because of the vaccine, or is it happening anyway? It would have happened regardless. And I think that right now there's no clear link to there being clots. It's good to be monitoring this, but I think I'm surprised that so many countries have suddenly jumped on this wagon to put a moratorium on the dosing, because we're in a public health emergency and the evidence is not that strong.
So I guess the question is, Heather, as we look at this morning, is the concern that we should be focusing on whether or not there may be some minor anomalies associated with the AstraZeneca vaccine, or is perhaps the larger issue the clear message getting out there to Canadians and people around the world, the lives that will be saved through the administration of this vaccine, and to overcome whatever hesitancies there may be. And stories like this, and we're seeing actions taken by these European countries, aren't going to help the public health arguments overall trying to overcome any concerns that people, and I should say any hesitancies that people out there have.
John, thank you very much.